CBCT, so when we scan, we've got to think about these considerations when we're taking the CBCT. Here's the biggest one. If you guys take CBCTs in your office, I don't know if you always just have them go and sit in the machine and bite down with their teeth together, but I would really get in the habit of putting cotton rolls in between their teeth, because when we talk about merging these files all together, we need points of reference, and all the points of reference come from the tips of the cusps of the teeth. And so by putting a cotton roll in there, you're separating those teeth cusps so that everything can stitch. You've got those accurate points where the data can all line up together. If they're biting together, the cusp tips are all just disappear in the X-ray or in the CBCT. So make sure you're getting that scanned with some cotton rolls to open them up. Or you can do it with the composite like we had in that other patient, something to separate their teeth. So, we've got to think about what volume we're scanning in. A lot of our cases, we're just scanning the whole dual arches. We're getting everything. Make sure they're stabilized. Make sure they're not moving. Movement disruption in the scan, that's going to throw off your whole case. So get a good scan. Make sure they're stabilized. Think about scatter. So scatter, we get scatter from metal, and we get scatter from zirconia. So think about those two things before you just send the patient in. If the patient has 28 zirconia crowns in their mouth, that's a challenging case to get a good CBCT with teeth that show up. The bone will be fine, but you're going to have this scatter coming off. Some of the newer scanners are getting better at handling that, but in our world, scatter is a problem. And so we need that teeth data to stitch our STLs to. And if they're full of scatter and there's metal and zirconia everywhere, you got to think of a backup plan. And so that gets more, we're going to talk about that more in the advanced courses, like how do we combat that? But just know that that's an issue before you just send them to the scanner and then you go, their patient's gone and you're going to design and you're like, dude, I can't use this. There's scatter everywhere. So we've got to think about how to handle that. And then last thing, these are graphically heavy files. These are big, complex, deep files that are large. So we want to think about a way to store these. I suggest getting a cloud storage service. We use Google Drive. There's a bunch of them. And you save patient name in a folder, and you load all their files into that, and so it's saved forever. You got their CBCT in there. You got their STLs in there, maybe their photos. So think about how you're going to organize all these files.